Merci à tous d'être là. Ça me fait très plaisir de participer à cet événement, donc merci. Le prochain intervenant est le professeur Etzel Cardeña, qui, alors j'ai pris mon petit copion, est titulaire de la chaire Run au département de psychologie de l'université de Lund, où il dirige le centre de recherche sur la conscience et la psychologie anomale. Ces travaux, qui ont été récompensés par de nombreuses sociétés professionnelles, sont axés sur la recherche de la neurophénoménologie, de diverses altérations de la conscience et sur l'établissement des expériences anomales, y compris des phénomènes parapsychologiques, en tant que domaine légitime d'investigation scientifique. Il a récemment fondé le Journal of Anomalous Experience and Cognition, une revue universitaire multidisciplinaire à libre accès. Aujourd'hui, il va nous parler du fait qu'il se pose la question de savoir si les expériences anomales sont pathologiques ou non. Je vous cède la parole. Merci.
Merci. Bonjour. Je suis très heureux à être ici dans la ville de Paris. Je suis très désolé que je ne parlais pas plus français. Mais les slides sont en français. So if you cannot follow me in English, follow the slides. Before I start, let me just mention a couple of things. The first one, je remercie Anton pour son aimable invitation. And I would like to dedicate my presentation to a very bright researcher on hypnosis and pain, Dr. Catherine Duhamel, which left us a couple of days ago. But if you are interested in some of the most sophisticated analysis of the use of hypnosis for pain, you should try to consult her papers. She has, for example, a meta-analysis on the use of hypnosis for pain with cancer patients. So let me start. In a sense, I'm already going to give you the answer to this question, so you can go to La Pâtisserie across the street and get something good. And then you will actually enjoy this. The answer is the anomalous experiences by themselves, or extraordinary experiences, are not pathological by themselves. And let me see, this is not changing. Okay, now it is changing. It just took a while. If you want to know more about what I will be talking about, there will be an email address. You can always write to me. You can look at this book. It was translated into Portuguese in the middle. The second edition is on the right side. And for those who are into art, you will notice that those are paintings by Remedios Varo, the extraordinary surrealist painter who was originally from Spain, but immigrated to Mexico. So first thing, what is an anomalous experience? When we use the term for our book, we wanted to make certain, to make it very clear that we did not assume that unusual, extraordinary experiences, such as hallucinations, even hallucinations, near-death experiences, mystical experiences, experiences where you feel that you are able to somehow contact the mind of others, that they were not necessarily pathological. So let me ask you, do I have a pointer by any chance?
I have one.
Merci, Audrey. Another brilliant researcher who's thankfully here. So,
Est-ce que quelqu'un a un adaptateur Mac USB? Ah, juste le pointeur. J'en ai un, moi. Ouais.
No, I think you need to put it.
Yeah, but it's...
Oh, it is.
But I think it's okay. Yeah, you can point.
Yes, okay, merci. And then... Okay, merci Abu. Thank you. First, we wanted to make sure that by anomalous, we do not mean abnormal in the sense of pathological, that it was not necessarily pathological or subclinical, that it was not normal in the sense that it is not the typical experience, the typical everyday waking experience. Notice, for a particular culture at a particular time. One thing we have is blinders for how limited each culture allows human existence or human experience to be. And things that we take for granted nowadays, for example, being here under a kind of trance, if you will, in front of a screen, would probably be considered abnormal in other cultures, and vice versa. So we are assuming something that is not particular for a particular culture at a time. And those are some of the examples. There are more. So what we mean is that anomalous experiences are not necessarily common. For example, synesthesia. In synesthesia, a person has the experience of a stimulus producing more than one sensory event, such as hearing a musical tone and matched to that musical tone, seeing a color. There have been some extraordinary composers who have been synesthetes, including one of my favorite ones who comes to France, Olivier Messiaen. Messiaen was a synesthete, and part of the reason probably why he has such extraordinary harmonies is because he not only heard them, he saw them as mixtures of colors. So they can be fairly unusual, or if they are not that unusual, as in people having the sense that they, for example, thought of a person they hadn't thought about in a long time, and that same day receiving an email or a call from that individual and thinking, oh, we must be in some way connected. We know from surveys across continents, across many countries, that the majority of people experience that. Just to check here, please raise your hand if you have felt sometimes had some experience like that, no matter how you finally interpret it. Clear majority, not surprising given that these are people interested in mental events. And I want to make sure that, well, I'll skip the second paragraph. And since again, I am in France, just in passing, I want to mention 2 out of many extraordinary pioneers. They did not use the term anomalous, but produces extraordinary works. And there are 2 of many. Of course, Charcot would be another one, and so on. But Pierre Janet, I have been rereading his De l'angoisse à l'extase, 2 volumes, strongly recommended. It is his treatise on Madeleine, a patient who was confined. She had extraordinary religious experiences. I think the only reason why she was considered a patient and not an extraordinary mystic was that she was not very social and wanted to go into a convent. If she had gone to a convent, I think she would have been the French Santa Teresa de Jesus, easily. It didn't happen. But what is fascinating is that Janet does describe to a great extent, using depths of her experience, what went through her mind, what types of behaviors she did. So it is an extraordinary phenomenological account of a person having anomalous experiences, and arguably pathological ones. Of course, we also have Alfred Binet, who wrote extensively about, for example, dissociative processes, in addition to writing plays, for those of you who may not know that. And there were a number of others who were not only thinking about in terms of this is pathological, but trying to understand it, describe it. And I am learning from reading Janet right now, as probably all of us could. So when we talk, again, coming back to the definition, anomalous experiences, one thing that I have been concluding after years of devoting to this topic is that they're really more frequent even in our secular cultures, other than perhaps some academics, that they're more frequent than we think they are, that there are strong cultural and subcultural variations, and they are spread across the population, and that they can have positive effects. So actually, I think a very important aspect that perhaps you cover in your university, in your courses or not, is that I think when we have to reconsider pathology as not something about unusual experiences or unusual beliefs, but about looking at what we might call higher order variables, such as frequency, effect on the person's emotions, and so on. That is really what is underlying whether some event is pathological or not whether it is shared by many individuals. In fact, I think if we were to start talking deeply with anybody else, we would find out that we are really in some ways similar, but in some ways very different, that there's an enormous amount of variation and that human experience is much broader than any culture typically allows. So, first point, anomalous experiences are not necessarily unusual in a particular culture. I am taking here the research done in Brazil by Monteiro de Barros and their group. And I will explain briefly, this is not as challenging as you might think. What they did was a representative survey, enquete, representative survey of the Brazilian population. And they asked them, across educational levels and so on, have you had spiritual or religious experiences? And in that questionnaire, they included what we might call anomalous experiences, mystical experiences, out-of-body experiences, all that jazz, telepathy. And the people could respond from 0, no, that has never happened in my life, to it has happened to me 16 or more times. And in Brazil, at least, what is really unusual, and I have been in Brazil and I'm not surprised about this, are the people who said, no, this has not happened to me. That's 6%. So they are really the unusual outliers. 94% of the people who answered that survey said that had happened to them, 1 or more, and actually the people with 1 were unusual. And the largest amount, 8.6%, were people who said, this has happened to me many times. Okay. So this is also, in a sense, a plea to consider expanding our notion of what can be within the domain of human experience. And I will talk a bit about 2 different aspects. And if there is something that is unclear, I will endeavor to finish so that we can have some question and answer period that can modulate. There are 2 things that I want to mention. The first one here is that rather than be thinking about, with respect to anomalous experiences, rather than thinking about pathology, we need to be thinking about human traits. That is characteristic aspects of human in which we vary. All of us vary. For example, I won't go into all of this, but the notion of self-transcendence or auto-transcendence, in which people may feel more or less part of something larger than themselves. Maybe they feel part of the whole society, of nature, of the universe, or at least of their colony, who knows. But that is self-transcendence and absorption and so on, and personal limits or mental boundaries. And we know that all of these are associated. We did a study, and we found something that is not surprising, at least for me, that all of these types of traits can be considered, at least in my interpretation, as propensity to have anomalous experiences, a propensity to have altered states. And we vary in them. Let me give an example, limite mentale, or mental boundaries. And that is a concept that comes from Hartman, Ernest Hartman. And he said, from his research, which has been corroborated, that, for example, there are people whom we might think of as having thin mental boundaries. Thin papier, very small. And those are the kind of people that are more likely to go into the arts, in which they have an emotion, a sensation, and they can more easily make it into art. or when they are in a relationship with someone, they may feel that they become one entity with the other individual. So those are more the thin boundary individuals. The thick boundaried individuals, and probably many in this auditorium will be more on the thin boundaries, because to be interested in hypnosis already means that you are questioning an easy distinction between what is objective and subjective, which hypnosis does. But the thick boundaried individuals on the other side, and there, for example, you would have civil engineers in the research by Hartman, were the people who thought, well, it's very clear where I am. I'm not connected with other people. You know, each one is an individual. And if I'm in a relationship with someone, I do not feel that I merge into that person. I may say, that was really nice for me. How was it for you? But there is no experience of, wow, that was great. I do not know where you started and where I ended. They do not have those types of experiences, and they have their advantages. One of the things is that I do not think we should all be one way or another. It's good to have artists. I'll go to Le Petit Palin later today, but it's also good to have engineers that are really interested in knowing what is the 10th decimal and are going to build the bridges that are more likely not to collapse when we go over them. So first thing is we have this personality traits that are predictors of who is likely to have anomalous experience. And okay, let me start in this one down here. I will get to these 2 points in a moment, but let me start with this point, which is that there are important cultural differences. Okay, and in the case of hallucinations, which I'm going to cover more in a moment, what we know is that in a study some years ago, looking where people asked, do you see or hear things that others do not? There were strong cultural differences. So in Vietnam, which of course has been throughout recent history a Marxist materialist state, less than 1% endorsed the notion that yes, that had occurred to them. Whereas in Nepal, almost a third of the people said, yes, that happens to me. And unless you believe that about a third of the Nepalese people are schizophrenic, you have to think this is not about pathology. This is about what kind of experiences people tend to have. I'll come back to this slide in a moment. Let me, yes. Following along with the notion of culture, I just want to also mention that there are important differences even within a culture. Okay, so for example, there is a classical study by Ries, 1971, which was replicated not so long ago in Denmark by a female PhD. I was in her committee, where you find that about 50% of the people who had lost a mate recently reported that they saw or heard or felt, were touched by the deceased individual. So about half of them. This was in West countries. Probably they would be even higher in some of the countries. This is already what I mentioned. But this is an example of how there are also important subcultural differences. This is a paper from New Zealand by Lindsay et al. And she had a hallucination, she had a scale of anomalous experiences. And what she found was that people who were Maori, that is, they came from indigenous roots in New Zealand, they endorsed significantly more spiritual anomalous experiences than did the people who had European roots. Okay, so probably if you did a survey like this in France, you would also find that there are important differences depending on what subculture the person comes from. So now let's get back a bit to hallucinations and why they should not be considered necessarily pathological. First point is, yes, of course, some people who have been diagnosed with schizophrenia have a number of issues that I don't think would could be argued are problematic for themselves, sometimes for others. But there is about 1/3 in studies done in the Netherlands, about 1/3 of the people who hear voices and are fine. They do not show any more pathology than the population at large. So that is not the majority, but it is a very substantial minority. So one needs to consider that that happens. And when you look at diagnosis, the diagnosis of schizophrenia, which is extraordinarily robust across cultures and across times, it has remained pretty much the same for the last few decades, hovers between around 0.3 to 0.7%. So let's say about 0.5% of the people at some point in their lives may receive a diagnosis of schizophrenia, whereas the percentage of people who, even in Western society, endorse having had a hallucination, having seen or heard something that other people did not, is more than 10% fold. It's around 8 to 15%. Let me show that to you graphically. Okay, so here is about the percentage of people, that small vein, the percentage of people who will receive a lifetime diagnosis of schizophrenia. And this is the percentage of people in the Western countries, who mention they have seen or heard things that others had not. This is more than 10% more. And even if you said, well, maybe some of these people have not been diagnosed, but maybe they should have. So I'll say, okay, cut this chunk there, add it to the people with schizophrenia, and still you see that there is a strong difference between the people who have these experiences and do not receive a diagnosis and those who do. Yes, that is what I wanted to mention about this concept. And perhaps the other thing is that initial about 8 to 15% of people in the West who mention they have seen or heard things that other people had not at some point in their lives has remained very consistent. The first survey was carried out by the Society for Psychical Research, a committee created by Nobel Prize winners and other very eminent scientists, who ended up investigating and proposed that there were about 11% back in the earlier part of the 20th century. They did a survey about 100 years later, and they found almost exactly the same figure. So again, that makes me think this is a trait, not a pathology. So following right along, let me give you some more evidence that to have unusual anomalous experiences is not necessarily pathological. And here I'm going to use some of our research. We published a paper in 2015 with some colleagues from Denmark. And what we have there was a comparison. First, the people who are in the, let's say, more reddish or darker, if you will, orange. Those bars are people who were self-defined as psychic practitioners. Individuals who may say, well, I see auras, I communicate with angelic entities, and so on. And the people in the more orangey yellowish bars are scores that come from people who were matched by gender and age, who were healthy, psychologically healthy inhabitants from Copenhagen. And all of these scores refer to subscales of a psychological questionnaire called the Brief Symptom Inventory. You do not need to know about that, but I'll give you essentially the take-home message, which is that the people who were psychic practitioners did not differ from healthy inhabitants from the same culture. They were pretty much the same. Actually, the psychic practitioners did a bit better, even though it's not marked there. It did not come out for some reason. Well, I cannot do anything about that, I guess, or maybe I can. No, it doesn't come here. They did a bit better on something called anxiety, paranoid anxiety. They felt more calm. But I think probably that may have just been a chance difference. But essentially the issues, they did not differ. when answering, and this limitation is it was a questionnaire, they did not differ. Now, having said all of this, another question might be, oh, are you saying that everyone who has an anomalous experience is psychologically healthy? No, mais non. Absolument no. You know, I get a call maybe once every couple of weeks or an email or somebody who tells me, I have a neighbor, he or she is sending me telepathic messages and I need your help. And I just say, well, you know, if this disturbs you, go and see a practitioner, a professional, but I cannot do anything. And here goes to another group that we also surveyed. And these are, again, the darker bars. These are responses on a questionnaire, on the brief symptom inventory. And these were people who were psychic practitioners, but who were in a retreat, who were staying in a center because they said that life was being somewhat difficult. And for this questionnaire, they were all significantly higher. They were reporting significantly more distress than a matched group of inhabitants from Copenhagen. So this does not mean, oh, everybody who has an anomalous experience is fine. The same way that you cannot say just being a left-handed person means that you have pathology. The majority of people who are left-handed are fine, but there are some people who are left-handed who have problems. Okay, so that was the next point, which takes me to how I think we have to consider the relation between unusual or anomalous or spiritual experiences and pathology. And that is to look at what I would call the superordinate variables, the more important variables. Here I am basing this slide on a study by Powers and collaborators. And what they did was compare mediums, let's say psychic practitioners, people who might say, I communicate with the dead, you come and meet with me and I'll put you in contact with somebody who passed away, and people who had received the diagnosis of schizophrenia. And they both said they heard voices. But what differed between them is, on the one hand, according to this study, was their attribution. That was the notion of, for the mediums, the notion was, yes, that comes from a deceased person or a spiritual force. And it is not something negative. It is something positive that I'm able to communicate. Whereas for the patient with schizophrenia, the attribution was, I have this horrible voice that is trying to control me and that is telling me to hurt myself or do something along those lines. Next significant difference between the two was that the mediums had less fear. They heard the voice and they said, well, you know, I'm communicating with someone. That's it. Why should I be scared? Whereas the patient felt afraid of the voices that were telling them, for example, terrible things such as you are dreadful, you are garbage, and so on. The mediums engaged with the voice. They said, yes, I'm hearing you, you're asking me to do this, but I don't think that's a good idea. Or maybe you are not such a good spirit to talk with, put me in touch with some other spirit. They were interacting, dialoguing, and they had more control of the experience, or they felt that they had more control of the experience. Whereas the people with schizophrenia said they were very afraid, they did not engage with the voice, they just felt that they were passively having to deal with it, and they were not having a sense of control of it. Incidentally, just as a parenthesis, even though this is not about therapy, when people started, the people who initiated the Hearing Voices movement in the Netherlands, which has become an international movement, when they have been using therapy to try to help people who are distressed, who have schizophrenia, part of the treatment that they are using, or part of the support, is to have people realize that they have more control, that they can do more about than just being passive sufferers of the voices. Okay. So that is one point. And Sorry. Yeah, this one. Some other aspects that have come from some work that I have done with an anthropologist from Vienna and from a physician, a psychiatrist from Brazil, and also other independent group, Handy et al., is that we have proposed that there are what again I call the superordinate variables that are what make an unusual experience problematic or not. First is, does it bring about chronic distress? Temporary distress, no problem. If you have been, as I have, involved in some rituals, let's say possession, spirit possession rituals in Haiti or in the Dominican Republic and so on, you know that during the ritual sometimes people feel pain. They fall, they seem to be disorganized. But once the spirit has taken over them and they come back, they are fine. They actually feel better than before they had been possessed. So it is not ever having some kind of anxiety, but whether the suffering is chronic. So that is problematic. Second problem is whether the experience is brief or whether it is chronic. So let's say from the work with people who are possessed by spirits in other cultures, you know that most of them get possessed during the ritual, but once that is over, to give an example of a gentleman I interviewed, Max Vauvois, I could chat with him about his master's in biochemistry from Cornell. We could chat about states of consciousness. We could chat about other things. And he was able to do a business. And at times when he had to consult with people from Haiti, he would make himself be amenable to being possessed by spirits. So is it flexible or is it brief or is it chronic? Is there flexibility? For instance, the people, as an example of the Haitian priest, can they realize when they can do it? Can they control that it will be in a ritual setting as compared with somebody who has no control, goes to a job interview, and in the midst of the job interview is possessed, let's say, by Ogun, who is really the macho, one of the macho, well, the main macho spirit in the voodoo pantheon, and would be very aggressive, which would probably not be a good strategy when you are in a job interview. Next point, whether the experiences are integrated socioculturally. In the case of voodoo in Haiti, no problem. There are all kinds of theories about it. And also the last point is that you have to consider the stage of development of the event. And this point has become particularly central to me in the study with Yvonne Schaefer, because she followed a person who, when he was a kid, was falling down, was unable to remain in school, was seen as a pathological garbage, essentially, by his father, who also despised him because he was gay. And eventually an aunt said, oh, what is happening to you is that you have a facility to become a medium, a conduit with spirits. And later on, he became a recognized Haitian voodoo priest, Dominican Republic voodoo priest, who is successful, who is making enough money to build himself a place to live, who has clients, who's doing something useful. So one also needs to take into consideration where in the stage of life the person is and whether there might be positive or negative developments. And let's see where we are. Yeah, we are doing fine with time, okay. To take this one point further, that this model, and we have the model in the book, is what we propose is that what you may have is an interaction. An interaction is the joint action of two variables, how two different variables affect each other. And I'm going to give an example from research from Cloninger and collaborators who have worked in Brazil. So Cloninger, a very eminent psychologist, personality psychologist, came up with a trait, it's not part of the big five, which is typically the better known taxonomy of personality traits. His I like better because his includes self-transcendence, let's say this propensity to have unusual states. So for Cloninger, whether self-transcendence ends up being positive in your life or negative in your life, as measured later, depends on the interaction of that variable, again, on the interaction of this trait with two other traits. The first one is, I don't remember what it was in English, but sociability or forte coopération, that you are able to be socially engaging, or that you can have a social network, that you are not just isolated alone in a corner. So it depends on sociability and what I would call initiative, or what you have there, autodeterminación. So if you have those traits and you are high in self-transcendence, what they found is that you will have successful psychological traits. You will be psychologically healthier than average. Not only average, but you will be healthier than average. However, if you have high self-transcendence, but you cannot get along with anybody else, but you have there as favorite coopération, and you have no initiative, you have no autodeterminación, then you are likely to have problems. And then you are likely to be in a corner shouting that you are perhaps hearing the voice of God, but you have nobody else to talk with. You are not doing anything with that experience. And to give you an example of how you can have these traits interact to bring about a positive outcome, I'm going to refer to a Swedish. I live in Sweden right now. And Hilma af Klint has become one of the best known artists in the last few years. The history of art is being rewritten thanks to her, because before she was quote unquote rediscovered, another rediscovery of extraordinary women who were just ignored for a long time or not paid their dues. She was in the last maybe couple of decades rediscovered as one of the originators of non-representational art, or shall we say abstract art. Now, before that discovery, you would have read that the people who started abstract art were Kandinsky, and maybe Kokoschka, and maybe a couple of others, all of them men. No mention of Hilma af Klint, even though she had exhibited some of her work during her lifetime. But now it is very well known. And one of the things that we know about Hilma af Klint, I know some things about her life and so on. Well, actually, a couple of things about her. First, she was able to create strong social links. She was part of a group called De Fem in Swedish, the Five, Le Cinq, and they were all supporting each other, doing medium seances. And they were helping with doing art in enormously big roles. Painting. So she was very sociable, and she had very strong initiative. She had learned how to do the signs, and when she heard voices, because she had anomalous experiences, when she started hearing voices of what she said are higher forces, they are spirits that are asking me to convey a message to humankind about what is, for example, the relationship between the genders and between matter and spirit. She not only heard that, but she said, well, I'm hearing that, I'm seeing images, they are guiding my hand. And she started getting the rolls of paper, getting the paintings, co-working with the other people, and creating this extraordinary art. And I invite you very much to Google her, get some books of her painting, because most of them are just extraordinary, breathtakingly inventive. Yeah. So that is an example of somebody who had unusual experiences, and by the way, was also considered by her nephew as being a psychic in the sense of having paranormal abilities. because the nephew did describe that she had a precognitive dream about a very specific date, and that she usually, or every so often, could predict things that were going to happen in the future. So that's Hilma af Klint. So last slide before we see how much time we have. So what else can we say about now positive aspects of having anomalous experiences, of having that transcendence? And just this slide is something I could do a whole presentation for the whole 6 hours, of the symposium, but of course we do not have time for that. But let me mention some of the things that we do know about them from experience of a number of people. First, research on schizotypy. Schizotypy refers to people whose one or both of their biological parents have been diagnosed with schizophrenia. Okay? So schizotypy means that a person has a predisposition to have schizophrenia, but that predisposition, is not that large. So instead of being 0.5%, it may be something like less than 10%. It is the majority of children who are children of biological parents with schizophrenia but have not been abused are not going to develop schizophrenia. One thing we know, though, is that those children may have higher scores on 3 different factors. The first factor is our friend, which in the case of schizotypy literature is called having unusual experiences or beliefs. Anomalous experiences, same thing. That factor by itself is very predictive, or fairly predictive, of one thing only, and that is of being more creative than average. It is not more predictive of you developing schizophrenia or having anxiety disorders. It is predictive of you being more creative than usual. However, if you also have higher scores on any of the 2 other variables, then you're more likely to have problems. And again, think about in terms of interactions. The other 2 is whether you are not social. You have anhedonia, you do not want to get out of bed, you do not want to do anything, you find no pleasure in anything, not even in a good croissant, nothing. That is not, that is a bad aspect. And the other aspect is to have cognitive disorganization. And cognitive disorganization is being unable to organize your thought and your speech. I could give you an example of cognitive disorganization if I try to continue right now speaking in French, but I better not. So again, the issue of just having unusual experiences is not problematic. So that is one aspect. It actually makes you more likely to be creative. And what we know from experience, from a lot of research of unusual anomalous experiences, such as near-death experiences and mystical experiences, is that they, not for everyone, we have a paper right now being reviewed in the journal that author is in the editorial board. We have a paper now on the review that a minority of people may have negative near-death experiences, but the majority do have positive experiences. And they include, for example, having decreased fear of death, having greater altruism, being nicer with others, even not those close to you, finding more sense in life, being more open to experience. There is a trait called openness to experience. So not just going along doing the same thing that you have already known and experienced, but being open to other experiences. And more arguable, some people say that they have also developed parapsychological abilities. That there is no particular research, because that you would need to test to see whether in a control setting that shows up. So in conclusion, what do I tell you? I told you at the beginning, the answer was anomalous experiences are not necessarily predictive of psychopathology. So now you can go to the patisserie. And I come to the end and I just reiterate the notion, but now having given you some information and actual evidence for how that is and how what you need to consider are a number of other variables. Before opening it for questions, one other thing, I know this is a day dedicated to trans. I actually do not like to use the word trans because I find it extraordinarily vague. Sorry, Anton. But I hope if either we see each other again sometime in the future, next year or sometime, or you read a paper, I am right now working with an international group of experts to try to come up with a better categorization. Because right now, for example, you use trans for shamanic magical flight and spirit possession and dissociative experiences and all of that. And then you say, well, they're not all the same. So we are trying to develop something to go beyond the 19th century and the 20th century that may clarify things. So we'll see if, well, we should have a paper in the next number of months, and we hope whether that sticks. So with that being said, and with my apologies, because my using his image is not that I endorse what he did in the Oscar Awards last time. He actually slapped someone, but I could not find another photograph. I have to say merci pour votre attention. Et merci. Merci.
On a le temps pour quelques questions. Est-ce qu'il y a des questions dans la salle ou sur le Zoom aussi? Juste dans la salle. Oui.
Yeah, absolument.
Ah, pardon. C'est vrai que ça va être compliqué.
There's another one?
Ah, ok. Nice. Allô?
Yeah.
C'était où? J'aurais dû aller par en haut.
Oh oui.
Okay, thank you for your presence and for your presentation. When you were speaking about mediums versus patient with schizophrenia,
Yep.
you mentioned that person who experiment hallucination, not pathologically, have certain characteristic of experience. They are in control in relation with their hallucination. Do you think that it would be a way to help patients with schizophrenia to put them in contact with a non-pathological psychical practitioner to maybe teach them a more appropriate way to experiment hallucination, or if you know place or researches where this is experimented? Thank you.
Yeah, merci. Merci pour votre demande. I would say that the literature on the hearing voices movement does show that just letting people know that they have more control, first, that they can exert some control. And here, using hypnosis can be very useful, because one of the things is if you just tell a person who's hearing voices, you can control that voice, that probably the person is going to say, well, no, I cannot. It's, you know, I don't want to have it here. But one of the examples that one could use using hypnosis, let's say for pain, is that one can tell a person, okay, can you now increase a bit the pain, or can you increase right now a bit of the volume of the voice? You use suggestions. And that people can do more easily. So once the person realizes, yes, I can hear it more clearly, then you can say, well, the same way you can hear it less clearly. And you can give them controls to have more or less vivid imagery. So that is one thing that could be done. The other thing that is done in the hearing voices movement is to also identify where those voices, the pathological, the really nasty voices come from, which very often, surprise, surprise, come from people who mistreated them early in life. So if you had somebody who had a parenting role telling you that you were useless and you were garbage and so on, you are more likely to integrate, to introject, if you will, to introject that voice and have it as coming from somebody else. So those would be, for instance, two ways in which you could help people who are hearing voices. And the third one I would say is, after hearing this lecture, you could say, well, you know what? A number of us, there are also other people who hear voices and who do not find it problematic. So you may be able to reach that. It is not that you are unique, and you may also have company if you are able to decrease their level of violence and virulence, and know that also other people are hearing voices that are not that problematic, to, in a sense, normalize a bit more. Because I think one of the issues about hallucination and a lot of pathology is that some of us were taught you are either pathological, you have a psychological disease, or you don't. And the minority have that, and the rest of us are fine, which is not true. Even in hallucinations, I can tell you, if you think you do not hallucinate, I won't ask for lift of hand, but even if you think you do not hallucinate, that you do not hear things that are not there, we could do a quick experiment to condition you to hear a sound whenever you see a grid. And after a while of matching that, we can just show you the grid and you will hear a sound that is not there. So depending on the circumstances, all of us hallucinate. Or if you are very stressed, you are more likely to interpret the sound of the wind on the trees as a voice, perhaps saying your name, than you ordinarily are. So essentially, it is also good to think about normalizing, but also addressing what is being problematic, let's say, of the voice, where they might come from. Does that deal with? Okay, yeah. Anybody?
Thank you.
There is one here, and tell me when to stop. Okay.
Thank you. The way you talk about Will Smith slapping someone.
About what's up?
Will Smith slapping someone raises the question about the hallucination are oriented towards perceptive fields, and it's a lot more problematic when we talk about somatic hallucination or synesthetic. And I wonder if the question of hallucination can be put on emotions. Excuse me. For example, is anger, wrath able to be considered as a moment of hallucination? Is there researches about emotional hallucination? Is it possible to distinguish between animal and normal state of emotion? And it raises also a political dimension, because we are in a certain state of emotion, each political group, and we can, there is a collective hallucination that has been recorded in history, that can lead to question the hallucinational state of groups regarding their emotion.
Yeah, merci. I would steer away from calling emotions hallucinations, because emotions, yeah, they are internal. I don't think you can deny you are feeling something. The issue is where it comes from, what you do about it, and how much. What would be similar is that you can also, with emotions, use some of the same strategies as with hallucination, thinking about how you can be in greater control of them, how you can think about whence might they come? The same as with voices, one might think of, well, if I suddenly feel this enormous rage and I want to kill someone, well, where does that come from in my history in this more immediate moment, and how can I modulate it? So what you would need to do, I think, is to also conceivably use hypnotic or other strategies to give people greater, let's say, wisdom and abilities to modulate emotions so that they don't end up shooting off. I mean, one could also think of, yes, there is a problem with rage, but in the dissociative area, you have the problem of people not feeling much, of being numb. And there you can use the opposite. Instead of decreasing synesthetic awareness, you can try to have people increase their notion of subtle introspective awareness, so that they start realizing more about their bodies. If they start moving it, most likely they will start feeling a bit more and having them focus more on it. So it really depends on what the circumstances are and how much you want to give people the ability to understand the sources and the ability to modulate them. I think in that case, you could apply the same thing for bad hallucinations, negative hallucinations, and destructive emotions. Thank you.
Personne?
Thank you. I've got a kind of dilemma as a clinician working in psychiatry. I'm confronted more and more to people processing to kind of spiritual bypassing. I don't know if you know the.
I don't know what that
it's a term concept that means that people are going through a kind of parapsychological explanation of their situation, and sometimes with narcissistic benefit. And they are going more and more to see the local neo-shaman instead of going to a psychologist or other kind of therapist. I'm quite open to all those phenomena, but when are we confronted to pathological processes? When is it just belief that we can let go? And I'm often disturbed by the vulnerability of all those patients to different kind of abuse. And have you any advices or a point of view on this situation?
Yeah, let me actually start with something exactly the opposite of what you're saying, and then I will get to that. The exactly opposite is that there are mediums who can be of great help. There is a recent book chapter by Camille Wardman, World Authority on Grief, and she very courageously talks about one of her patients going to a medium who told her very accurate, specific is the word, specific information about the person he had lost. And Camille said, well, that had much stronger beneficial effect than anything we had done in sessions for a long time. So some can be positive, but of course there are other people who may not be either very good at what they do, or they may be predators. They may take advantage of others. It happens everywhere, including with licensed therapists. I know if you follow the news in the United States, almost every week there is a story about some psychotherapists who ended up abusing patients in order to get more money from the government. So I think in the case of your specific patients, if they are going for shamans, the issue would be try to get to some ground to say, well, how much is that helping you? What are the consequences? How much are you getting? And I would say, rather than saying do not, because one of the things we know was we are children still. If somebody tells you do not, they say, well, then I will. Rather than saying that, trying to find out an area where you say, well, what you can do with me is somewhat different. And see if you can have a greater, more positive effect, and you end up rather than an incompetent or dishonest practitioner. Now, sometimes there are some dishonest practitioners that should be denounced to the law. But, you know, now we're going to that extreme over there. But even not going to that extreme, just talking about well-intentioned practitioners that are not helpful, to try to be someone who is more helpful, and then let the people decide whether he or she wants to continue with you. That's the only thing that comes to my mind.
Thank you.
Merci. Bien. Merci. Au revoir.